Welcome to my channel, PeekAboo-AI Surveillance, where we explore the many ways AI is being used in video and audio surveillance. If you're new here, please subscribe so you do not miss out on any news or information about AI surveillance you might want to know about. There may be some helpful links in the description below, so be sure to check those out. To all my returning subscribers, welcome back, and let's get right into the tutorial. AI surveillance, combined with machine learning, is making a huge impact on public health. So, how exactly does this work? Public health surveillance is the continuous, systematic collection, analysis, and interpretation of health-related data. Think of things like disease reports, lab results, and hospital records. It operates like an early warning system to identify outbreaks, monitor trends, and guide immediate, evidence-based actions by public health authorities. Let me break down some key aspects for you. First, let's talk about data sources. Information is gathered and analyzed from several places. This includes mandatory disease reporting by doctors and labs, electronic health records, vital statistics like death certificates, and laboratories. This process follows a 5-step cycle: data collection, analysis, interpretation, sharing the findings with decision makers, and then taking prompt action. There are also different types of public health surveillance. There's passive surveillance, where healthcare providers simply submit cases as required by law. Then there's active surveillance, where health officials actively reach out to doctors, labs, and hospitals to find new or old cases. We also have syndromic surveillance, which monitors symptoms like flu-like illnesses even before a lab diagnosis is confirmed. And finally, sentinel surveillance uses a pre-selected network of hospitals or clinics to track specific, emerging, or ongoing health issues that keep popping up. The main goal of all this is to be action-oriented. It's not just about collecting data. It's about informing, planning, and evaluating public health interventions. The surveillance tracks who is affected by looking at demographics, where they are geographically, and how severe the illness is. Here's a quick workflow example to put it all together. First, detection. A doctor or lab identifies a reportable disease, like the measles. Next is reporting. The provider reports the case to the local or state health department. Then comes analysis. State health officials analyze the data to identify any trends or potential outbreaks. After that, it's time for action. The health department might start contact tracing, launch vaccination campaigns, or issue public health alerts. Finally, for national reporting, states send relevant data to the CDC for nationwide monitoring. Now, we also need to consider the challenges and ethical considerations. Data privacy and security are huge. Sensitive personal health data must be secured to protect against breaches and maintain public trust. There's also the issue of bias and inequality. AI models can reinforce health disparities if they're trained on biased or non-representative data, which could lead to neglecting marginalized communities. We also face accuracy risks. The potential for false positives or negatives always exists, which means we need to constantly evaluate how well the algorithms are performing. And then there's transparency and regulation. We critically need clear guidelines to address the black box nature of some AI techniques, ensuring everything is accountable and used ethically. Despite these challenges, AI is increasingly seen as a crucial tool for transforming public health surveillance. It's helping us move from a reactive system to a more predictive and efficient one. Many thanks for taking some time to check out my tutorial. Any links will be in the description below. Please subscribe so you will not miss out on any important AI surveillance information that is currently out there. Make sure you check out the thumbnails that will be floating around at the end for similar content. And don't forget, PeekAboo, I see you now.